My name is Amanda Cross, and I'll be discussing physician-patient miscommunication. The Art of Communication is the Language of Leadership by James Humes. What I will be discussing is why I chose this topic, each article and their importance, the barriers and benefits from the articles, the mindfulness movement, my interview with Melissa Muse, who's a physician assistant, and the strengths and weaknesses from my articles. First, why I chose the topic. I chose this topic because I myself have had miscommunication with the physician. It hasn't always been easy. I was diagnosed with an autoimmune condition that took a long time to diagnose, and it was mainly because of miscommunication. They weren't listening to me. I don't know if I was quite listening to them, what they were having to say, but it took 3, 4, 5 years maybe to really get it diagnosed, to really find somebody that actually heard me and communicated with me. The processes that I'm going to focus on are going to be the benefits, the barriers, and how the communication can be improved. What I hope to learn from this research and my interview with Melissa Muse is the proper ways to improve that communication between the physician and their patients. My first article is about the basic principles with practicing good communication. With good communication, it's important to really listen to the patient, listen to what they have to say, and really hear them out. It's also important to have that empathy for them. Paying attention about that verbal and nonverbal components of communication are huge. A physician should be exceptionally cautious while breaking bad news and managing difficult encounters with patients, such as the nature, the course, and the prognosis of the disease. Due to critical principles, it's necessary for the physician to undergo formal training of how to properly communicate such skills with the patient. Along with that, verbal, nonverbal, and paraverbal components are very important. With verbal, that's going to be the content of the message, including word selection. Nonverbal is going to be the body language, such as facial expression, gestures, postures, and even spatial distance. How far are you from them? Are you staying distant to them, or are you really up close to them, really hearing them out? Paraverbal is going to be your tone, your pitch, your pacing, your volume of voice. It's going to be, are you angry with them? It's going to be, do they feel like you're really listening, but are you listening? Are they listening? It's going to be if you're talking fast, if you're rushing to get through that encounter with them to get to your next encounter because you're falling behind your schedule. Nonverbal and paraverbal components contribute to 90% of total message being delivered. It's always going to be the little things. It's going to be, are you tapping your foot on the ground to really get through? It's going to be if you're having a smile on your face. It's suggested that nonverbal communication is significantly important for patient satisfaction, adherence to advice, and clinical outcome. The benefits of communication. The development of meaningful and trustworthy relationships between the doctors and patients is very important. You have a better understanding of the patient's problems when you build that relationship with them. Also, with good communication, it can decrease the work stress and increase job satisfaction for just the physician. And for the patient, the level of satisfaction will improve. This will further increase their compliance to the advice given by the doctor. They will listen to what you have to say, and they will take that in consideration and follow it. It will be a positive impact on the patient's psychology, mental health, and tolerance of power, but also their quality of life. Some barriers. There are several barriers to effective communication between the patient and the physician. The most important barrier is lack of insight. With lack of insight, this is due to inadequate knowledge and training in communication skills. The second important barrier is language. It is unusual for patients speaking in their native language to have a difficult time communicating and understanding their physician. This is not unusual at all. A language barrier is huge when it comes to communication. You might mean one thing, but they take it as another because they don't fully understand what you're saying. Third important barrier is the lack of adequate knowledge about the disease or treatment options. Stress, tiredness, or lack of time are also contributing factors in an overburden. My second article. So for the benefits of communication, these benefits are mentioned in this article include the potential to regulate patients' emotions, facilitate comprehension of medical information, and allow for better identification of patients' needs, perceptions, and expectations. Fong and Longenecker also discussed that a more patient-centered encounter results in improved satisfaction for the physician as well as the patient. Some barriers that Fong and Longenecker discussed are deterioration of doctors' communication skills and doctors' avoidance behavior. So the first one, about deterioration of their communication skills. These are the communication skills that decline as medical students progress through their medical education. And also, over time, doctors in training tend to lose that focus on their holistic patient care. Doctors' avoidance behavior is about reported observations of doctors avoiding discussion of the emotion and social impact of patients' problems because they could not handle these issues or they did not have time to adequately do so. And my article with Yip. The mindfulness movement was discovered by Dr. Ronald Epstein. This is a professor of medicine at Rochester University and a practicing physician who developed the mindfulness movement in medicine. Epstein explains how mindful self-reflection and self-regulation are key to mastering clinical care. This enables physicians to listen really close to their patients, make good judgments, but also act with compassion. There are 4 mindfulness skills that physicians need to provide quality patient care. These include attention, curiosity, beginner's mind, and presence. So first, attention. Because of everything they have on their minds, physicians may not fully are attentive in the exam room. Doctors rely on automatic, fast thinking when they interact with their patients, but by practicing mindful attention, they can really slow down to deliberate more conscious thinking when their patients present signs of something serious. With curiosity, this is developing a sense of curiosity to inspire physicians to ask more questions and dig deeper with their patients. This also helps foster empathy and understanding for their patients' unique needs, values, and circumstances. It also helps doctors recognize when something is off, when they can really tune into their patient's well-being. With beginner's mind, Epstein advises physicians to hold expertise lightly and be aware of their understanding of a patient's case, while based on expertise may be provisional and incomplete. He warns that self-confidence can get in the way of good care if physicians do not recognize that there are things they may not fully know. And presence. Listening deeply without judgment or interruption can be tough for physicians who have numerous other things to worry about. However, physicians' presence can help a patient understand and acknowledge while decreasing chances of miscommunication and error. My interview with Melissa Muse. So Melissa Muse is a physician assistant who currently works within CHI. I myself worked with her as a scribe at the Think Healthcare building. We worked alongside numerous physicians together as well as before I worked with her. She listens just like a physician does to the chief complaints, physically assesses the patient, diagnoses them, prescribes medication, but most importantly, she communicates with her patients what they can do to truly get better. So some interview questions I had with Melissa Muse included how to communicate with their patients to ensure they understand you. And Melissa told me repetition is huge. She could not stress this enough. She said to fully have her patients understand her, she's constantly repeating throughout their encounter. She even gives them a pamphlet and a handout for visit summaries. And this is especially important when she has elderly patients or English-speaking patients. And then we also talked about communication as a problem. She says that with that patients have more than one physician, it can be a problem because there are different physicians saying different things to them. She also said that with health systems, there can sometimes be an issue, but in Omaha, it's really good about collaborating with all the other health systems. It's when you get issues with smaller groups that it's more difficult and you have to request that information, and there could be a communication loss along the line. The biggest problem that she sees in the clinical setting is the misunderstanding of medicine and how patients are supposed to take it. She says to resolve this issue, she prints off visit summaries so they are provided with printed handouts when they leave. She understands that those might be lost, and she encourages her patients to call if they have any question whatsoever because that medication is very important. And with this communication with the patient not understanding can sometimes be an issue. Sometimes physicians seem to forget what it's like without having a medical background. It becomes second nature to them, and they just assume the patient understands what they're saying because they're not asking any questions. But also, patients might be embarrassed to ask such questions, thinking it might be a stupid question, but there's no such thing as a stupid question. Strengths and weaknesses from my articles include: the strengths are the authors of these articles are healthcare providers or have experience in healthcare, and there was consistency with these articles over how communication can be improved. The weaknesses that I noticed were communication is tricky and it's hard to determine the correct methods with every individual patient. People might also think the physician is being biased towards them or judging them simply when they're trying to communicate. This can also be a cause of miscommunication between physicians and their patients. These are my references from all my articles, and thank you for listening.